Calcium is the most abundant mineral we have in our body. For women, women can have up to 1 kilogram of calcium in their body, and men can have up to 1.5 kilograms of calcium in their body. So it is the most abundant mineral in our body. The RDA for calcium is about 1,200 milligrams. And signs of a calcium deficiency include nerve sensitivity, muscle twitching, abnormal heart rate, cramps, depression, numbness and tingling in the hands and feet, anxiety, lethargy, changes in personality, seizure, tooth decay, cataracts, stoop posture, dry skin, irritability, difficulty swallowing, and the jitters. So those are all symptoms of a calcium deficiency. Now on the left side of the board here in red, we have some of the functions of calcium, which include muscle contraction, the regulation of the heartbeat, nerve impulse, proper bone and teeth formation, the regulation of blood pressure, cell division, and proper digestion. So calcium is critical for all those functions on the left side of the board. Okay, so if you have a vitamin C deficiency, your dietary intake of calcium is going to be less than 10%. You're going to be absorbing less than 10% of the calcium that you take in with your diet if you have a vitamin D deficiency. So vitamin D is critical for calcium absorption. Now, if you're a smoker, if you drink a lot of caffeine or alcohol, or you have a lot of excess salt in your diet, as well as a high protein diet, you're also liable to have a calcium deficiency because all of those help drive calcium levels down in our body. Now, in the middle of the board here, I have the parathyroid hormone, which is a peptide hormone or a protein. It is obviously released by the parathyroid gland. And I'm going to have 3 functions here that the parathyroid hormone does for us in relation to calcium. On the right side here, we have the bone. So in the bone, we have something called osteoblasts. And these are cells that actually help build new bone for us. And they do that by producing a protein called collagen. And it's collagen that creates this scaffolding in our bone that allows this this mineral here, hydroxyapatite, to bind to this collagen scaffolding. And this hydroxyapatite is loaded with calcium. So every 1 molecule of hydroxyapatite is going to have about 5 atoms of calcium and 3 molecules of phosphate. Now, phosphate is phosphorus surrounded by 4 oxygen. And again, it's the collagen that is made by these osteoblasts that's used again as a scaffolding. And it's this hydroxyapatite, this mineral that kind of fills in the scaffolding and binds to the collagen that helps create new bone for us. And vitamin C, again, is critical for collagen formation. So if you have a vitamin C deficiency, you are not going to be able to use your calcium to make new bone. So there's a direct relationship with vitamin C and calcium. It's the fact that it can make collagen and it can help us make new bone, which has calcium in it. At the same time, the parathyroid hormone causes the kidneys to excrete this phosphate. So when the parathyroid hormone binds to the kidneys, it causes the excretion of these inorganic phosphate molecules. And as a result, it causes the bone to leach this mineral into the blood for us, raising our calcium levels. So again, the parathyroid hormone prevents the formation of collagen by osteoblasts, prevents us from needing calcium in the bone because we're not making new bone because we don't have any collagen. And as a consequence, it also causes the inorganic phosphate to get excreted from our kidneys and causes the bone to leach this hydroxyapatite into the blood for us. So the parathyroid hormone, again, raises blood calcium levels. The antagonist is calcitonin. Now, calcitonin actually drives this equation in the other direction and helps pull calcium from our blood for us. So parathyroid hormone increases blood calcium. Calcitonin increases our ability to make bone. So it actually pulls calcium out of the blood for us. Okay, finally, parathyroid also increases the active form of vitamin D from the kidneys, and that allows us to increase absorption of calcium from our food through our intestines. So it's our intestines that are the center point for absorption of calcium. And when we raise our vitamin D levels, we actually increase our dietary calcium absorption. So 3 ways that parathyroid hormone is used to increase blood levels of calcium. And the final obviously being increasing the active form of vitamin D. And finally, down here, if you have high diets of phosphorus, it decrease your calcium levels. So, diets high in meat, cheeses, and processed food are all subject to causing a calcium deficiency.